Hi guys. So I'm going to take my glasses off, but you may see me have to put it on a few times. I lost my contacts and I'm waiting for the new ones to come in. So I cannot see myself. Hopefully I look fine. um, so what I thought I would talk about today is I thought that we would talk about um, if I'm pregnant, is it okay to still breastfeed, my child that, I'm breastfeeding at the time. Um, so the simple answer, I guess there's really no answer, yes or no answer. Um, it's not definitely not something that you can't do. It's not told to be avoided or anything like that. In fact, you're probably going to get a lot of opinions about it. You'll talk to a lot of moms who've done it. You can talk to a lot of doctors who support it, but it really will depend on you and your doctor and your circumstances. If if you're not a high risk mom, if your baby who is breastfeeding at the time is not at high risk for already low on growth, not getting enough nutrition, if they feel the baby's not gaining enough, that kind of thing. So, in just a I don't want to say normal, but in just, I'll say a low risk pregnancy, um, it really shouldn't be an issue. Breastfeeding should be fine. But if you have any question or any doubt, I should say, then you should definitely talk to your doctor to find out if it's something you're going to do. Whether the doctors say yes or not or no, then you tell your doctor, this is what I'm going to do. I want to do this. And then the doctor can talk with you about how to make sure the baby's getting enough. So basically, your breast milk is going to change when you're about your fourth or fifth month of pregnancy. That's when the colostrum starts to prepare for the baby when the baby's born. So the milk that your baby is getting and has been getting is going to change, and it's going to have more colostrum in it. And colostrum is a highly laxative, it's very, very high, a very high laxative, I should say. And so the baby could have a lot more diarrhea. The baby could struggle with colic, all that kind of thing that comes with having a laxative in you. And the fear in that is a really loud airplane. The fear in that is that the baby won't gain what they should. So, like I said, if you have a baby at risk for already is at a high risk for birth, growth, or whatever, weight gain, all that kind of stuff, then it's definitely something you want to talk with the doctor about and really watch. Because I always feel like a doctor might tell you not to do something, and you as a mom say, you know what, I'm going to do it because I don't want to stop. So what I would say is, if you know you're going to do it anyway, just be aware of the changes of your baby and really, really watch how much they're eating. And the other thing that comes into play is, how old is your baby? By the time you hit that fourth or fifth month of pregnancy, how old will your baby be? If they're already will be a year old, then you're really fine, because the baby's going to start eating solids. They're not getting their main nutrition from your milk anymore. But if the baby's still under 1, then you might have to supplement with formula or human donor milk. And I do know some people who pump so much between that time period that they're able to use their pumped milk during the time that they can no longer, or they feel that they want to stop, like at the fourth or fifth month. Do some research on it. I am going to put a link below that you can also read up on, that talks about it and kind of like what, to look for and that kind of thing. I think that's probably, that's actually a really simple, I'm not going to make this a long video because it's a really simple question and answer kind of thing. So yes, you can breastfeed even though you're pregnant. But there are some things to look for, to watch out for, and to consider. Like I said, is how old will the baby be? And Are you at high risk or low risk for anything? Is the baby? So those are the kinds of things you have to think about. And then also just talking to your doctor and getting getting opinions, first, second, third opinions, whatever you have to do. And if you feel that what they're telling you don't agree with, then search more. And look for people and doctors who support breastfeeding. And then you'll be able to get the information you need, and what you need is a balanced answer, a reasonable answer. And I would never want to say, breastfeed and don't worry about anything else, because no, I mean, you have to make sure both babies are okay, and you got to make sure you're okay. So the other thing is for you too. You have to realize that when you're breastfeeding, you have to eat more calories. But now you're also pregnant, so you need to take in more nutrition because you're eating for two. So you're going to have to take that into consideration, making sure that you're eating well enough to not, because now you're giving to two babies. So you need to make sure that you're getting your nutrients in, that you're eating healthy, and that you're getting fluids, and you're, doing well. So that's very, very important as well. So that's pretty much it. Like I said, I'll put a link below so that you can do some research on your own, talk to your doctor. But yes, it is safe in most cases, but definitely things that you need to look for, and consider when you're making that decision. So that's it. I'm going to make another video on relactation. That can be for a mom who's pregnant, something that she might be considering later. It could be somebody who wants to, start breastfeeding again. It could be adoption. It could be mom wasn't going to breastfeed and then changes her mind. It could be mom who got sick and her milk dried up. It could be medication and the milk dried up. So it could be a lot of reasons why a mom might want to relactate or increase milk supply. So I'll probably be talking about that as well. So that's it. I hope that you guys are all doing well. Keep watching the videos. Please subscribe, and I will talk to all you guys again soon. Bye.